Hello, my name is Karen Tsveybel, and I'm the inpatient lung transplant coordinator. And today I'm here to talk to you about post-transplant lifestyle changes. In this video, we are going to review the process of going home after a transplant. We're going to discuss the lifestyles of changes after transplant. We're going to review personal care, and we're going to discuss specific precautions. Preparing to go home. You are trading one disease for another. Now, I know you have heard one or more of our providers tell you this once or twice since you've been through our program. What does that mean exactly? What it means is that you are trading your existing lung disease for another disease, which is being immunosuppressed or immunocompromised. We all have an immune system, and our immune system protects us from bacteria, viruses, infections, and foreign bodies. Those new lungs are foreign to your body. So, because your lungs are foreign to your body, we're going to need to give you medications to suppress that immune system. But now that you're immunosuppressed, that's going to put you at a much higher risk to getting sick, to getting the bacteria, infections, the viruses, and whatnot. And anytime you become sick with an infection or a bacteria or a virus, then your immune system is going to try and attack that new cold, that new virus, that new infection, but it's also going to fight those lungs. And to further explain, when you are exposed to a virus or bacteria, which can be spread to your hands by sneezing, coughing, rubbing your eyes, and then transferred to you by others, it could also be transmitted from animals, and it can also be from contaminated hands that have touched objects with bacteria and then transferred to foods that you then ingest. Once you're exposed to that, your immune system is going to react and try to protect. And when your immune system goes into attack mode, those immune cells are going to target all those areas that don't belong there, the viruses, the bacteria, that infection, but it's also going to attack those lungs. So you need to think about it that anytime you get sick with any other infection or virus or bacteria that you've been exposed to, you're putting yourself at a risk for rejection because the immune cells, they don't differentiate what to attack. They attack everything that doesn't belong there. So there are necessary precautions you must take after transplant to keep yourself protected from illness and rejection. Some restrictions and instructions after discharge are to wear a mask. You want to wear a mask in crowded places, hospitals, dental offices, grocery stores, shopping centers, anywhere where there's a lot of people. When the air quality isn't good, so oftentimes when there's a high pollen count, you want to put on a mask. And when you're around school-age children, especially during cold and flu season, oftentimes children aren't able to tell you when they're coming down with a cold or a flu or they're not feeling well. So you want to make sure that you're protecting yourself because they can be contagious and not know. Hand hygiene. You want to diligently wash your hands every time before eating, drinking, or anytime you may touch your face. So that's chapstick, lipstick, moisturizer, eating, drinking, shaving. Anytime your hands are going near your face, you want to make sure you're washing them with soap and water. You want to make sure that you are washing the palms, the backs of the hands, in between your fingers, the webbing underneath your fingertips, and let the warm water rinse off downward. You want to limit your visitors. You don't want to allow anyone coming over if they are sick, if they've been exposed to someone who has been sick. And you also want to make sure that they are washing their hands whenever they come in. There's no driving for 3 to 6 months post-transplant, and there's no travel for at least 6 months post-transplant. Home life. So cleaning, we want to keep the home clean and tidy. If you have carpets, we should be vacuuming at least 3 times a week. Carpets can hold a lot of bacteria and dust and mites, and so you want to make sure that you are able to vacuum at least 3 times a week, and you really want to dust and sweep daily. Now, if you are the recipient of a lung transplant, if you're doing any of these things, wear a mask. For gardening, unfortunately, there's no gardening, and that includes raking leaves and mowing the lawn, no fresh cut flowers, and no household plants inside the home. And that includes a real Christmas tree if that's something that you practice. The soil contains mold, mildew, yeast, fungus. And so if the soil is ever manipulated, it can be transferred to the trunk, to the branches, to the leaves, and then those microscopic particles can get kicked up into the air, and then you can inhale that. So that's the reason why we say no fresh plants or cut flowers in the home, and you don't want to be anywhere where you are actually exposed to any of the soil. You can be outside. Just if someone is mowing the lawn, then you'll need to come inside to protect yourself. For work, there's no work for the first 6 months. And once you're cleared to go back to work, it's really recommended to resume just part-time work. You don't want to dive all in all at once. So take your time in easing yourself back into work. Abstain from alcohol, no smoking, and stay away from secondhand smoke exposure. This includes fireplaces, wood-burning stoves, and outdoor fire pits. Check your basement for mold, and you really shouldn't spend any time in damp areas where it's susceptible to mold or mildew. Make sure you're changing AC filters and any other filters regularly. So that's HEPA filters, water filters, whatever it is, just make sure that you're changing them at the right interval. There's no sexual activity for 6 weeks post-transplant. And when you resume, we recommend that you use condoms to prevent infection. Report any genital concerns such as sores, unusual discharge, or potential yeast infections to your transplant coordinator as soon as possible. Sun exposure. Your immunosuppressive medications put you at a much, much higher risk for developing skin cancers. You must wear sunscreen, SPF as high as you can get it, and it needs to be broad spectrum. Anytime you're going to be out in the sun, you want to make sure that you're reapplying your hands because you're going to be washing them frequently. And if you're sweating outside, you want to make sure that you're reapplying. You're also going to need to see a dermatologist regularly. Pets. Existing dogs and cats are okay. Do not adopt or get a new pet, puppy, or kitten under the age of 6 months because they may have some underlying disease that's not yet discovered. There's absolutely no turtles, no reptiles, and no birds. They harbor a lot of infectious diseases, germs, and bacteria. So you're not allowed to have those ever. Pets must be up to date on all vaccinations. Don't let them lick your face or sleep in the bed. Do not clean their litter box. Wash pet bowls daily with warm, soapy water. Clean hard toys regularly with hot, soapy water, and wash soft toys monthly. Always wash your hands after you're handling your pets, especially before you eat or drink or touch your face. You can also prevent your pets from bringing in a lot of dirt from outside if you just wipe off their paws before you let them in. So where does bacteria live in your home? So common areas where bacteria likes to accumulate are the following. Kitchen. So in the kitchen, your dish sponges and rags, those are filthy. Rags need to be changed out daily. Dish sponges you can put in the dishwasher and run a cycle, and that should be able to clean your dish sponge, but you want to make sure that you're cleaning them regularly. Cutting boards, they hold on to a lot of germs, so make sure you're cleaning them really well. You don't want to cut any of your raw meats on wood because wood is very porous. So sometimes those germs can kind of live within. So you want to keep your wood boards for your fresh cut fruits and vegetables. And then you want to have a separate board for your raw meats, which is usually a plastic. Keep your countertop and sink clean. So your countertop is very dirty. Everyone's putting things down on the countertop. So you want to make sure that you're wiping that down regularly. Your kitchen sink, you're draining foods, you're rinsing foods, you're putting leftover foods in the kitchen sink. So that really needs to be cleaned out very regularly because a lot of bacteria lives there. Your coffee maker, you need to run clean water through the coffee maker every once in a while to make sure that that stays clean. Your refrigerator, that has tons of bacteria. You're storing raw foods, leftover meals, there's lots of spillage. And so if you're not cleaning all that appropriately, then that is going to accumulate bacteria and mold and things like that. And it can be transferred to, even your fresh fruits and vegetables. So you want to make sure you keep that clean. The microwave, kind of the same idea. You're constantly getting food splattered around. So if you don't clean that out, it's going to collect and have bacteria and germs. So clean out the microwave frequently. Your salt and pepper shakers, if you think how often are you actually cleaning your salt and pepper shakers? Everyone's grabbing those to make their meal how they want it. So many hands are touching the salt and pepper. Make sure we're cleaning those regularly. Dry herbs. When you are cooking with dry herbs, you want to make sure that you are keeping the container away from your cooking surface. So when you're holding your dry herbs over your cooking surface, there's a lot of heat and that can create condensation. That is going to create a form where bacteria can grow. So you want to make sure that you are using it away and ladle the amount of herbs that you're going to need in the meal that you're cooking. Throw away any really old herb spices that you have in your cabinets because most likely you have been doing that, practicing that way, and a lot of germs and bacteria is already accumulated in those. Knobs, handles, and switches, these are commonly touched areas, so they definitely have a lot of bacteria. Light switches, refrigerator handles, stove knobs, microwave handle, faucets, doorknobs, drawer handles. In the bedroom and bathroom, the shower, the tub, water accumulates, mold, mildew is there. You can find nice products on the market where you can spray a clean shower spray after every shower, and that kind of holds a lot of that mildew forming at bay. Drains and faucets, same thing, water accumulates, so mold and mildew can accumulate, so you want to make sure you're wiping that out frequently. Floor area around the toilet, I don't think I need to explain why. Bath towels, so we oftentimes use bath towels over and over again, and we really don't want to do that because the dampness can hold on to bacteria and germs and mold and mildew. So you want to make sure that you're turning them out more frequently. Toothbrushes, I can't stress this enough. The toothbrushes are going into your mouth, so you want to make sure that you are either keeping your toothbrush in a medicine cabinet or you have a toothbrush covering. When you are flushing the toilet, that kind of sprays, there's microscopic sprays, and you really don't want any of that being deposited, anything that's going into your mouth. So make sure you do that. Change bed linens frequently. We're all guilty of letting that kind of go by the wayside, but you really need to at least be changing them out once a week and washing them in hot water. The laundry, we're all guilty of this too. Don't leave laundry in the wash. You should dry your laundry immediately. If you're using a laundromat or a shared facility, clean the drum with a disinfectant wipe prior to using it. And use warm or hot water. This is most effective in killing both bacteria and viruses. Your office and living room. Think of all the things that bacteria can accumulate here. Keyboards, mouses, remote controls, tablets, video game controllers, even your office supplies like a stapler, a hole puncher, phone, and fax machine if this is something you use regularly. Your personal items, makeup bag and makeup brushes. Ladies, you need to clean your makeup brushes. A lot of bacteria accumulates on your brushes and you're constantly replacing them into the different products. So you want to make sure at least twice a week you're really washing those brushes regularly. Cell phones are filthy, so make sure you are cleaning them regularly. Keys, wallet, money, lunch boxes, work bags, backpacks, purses, headphones. Think about all the things that you commonly use every day that you don't even think that you need to wipe down. A couple more infection prevention at home. Practice good hygiene. Shower daily. Keep your hair clean and neat. If you have oily hair, try to keep it pulled back from your face. Wash your face in the morning and at bedtime. Brush your teeth morning and night. Floss and examine your mouth and gums daily. Protect your skin from scratches, sores, and other irritations that might lead to an infection. Even if you have a cut, a small one, even if it's a small one, clean the area well with soap and water. Dry your skin and cover the cut with a sterile bandage. Take off your shoes before walking through the house. Stay at least 6 feet away from other people in public. Cough or sneeze into a tissue or your elbow instead of your hands, and please try not to touch your face. Aspiration precautions. One of the biggest causes of rejection is acid reflux, aspiration, anything that's coming up from your stomach. It goes up, travels up your esophagus, travels to the trachea, and boom, down into your lungs. So we really want to prevent any sort of aspiration the very best we can. And things that you can do are you don't want to lay down flat. You should never lay down flat ever. The bed should always be inclined at least 30 degrees. That's with sleeping and napping. You can use a wedge pillow. All meals, you should be sitting upright at 90 degrees, no reclining at all. Avoid distractions when you're eating and drinking, such as talking on the phone or watching TV. Cut your food into small bite-sized pieces and always chew very thoroughly before you swallow. And just go slowly. Eat and drink slowly, and these things will help prevent any aspirations. Home management. You are going to be on sternal precautions for 3 to 6 months. And that means you cannot lift, push, pull anything greater than 8 pounds. You cannot raise both hands over your head. So here's okay when you take your chest x-ray, but up here is not. So we really want to keep the integrity of the sternal site intact. We can monitor on the outside, but we need to make sure that we're not pulling from the underside. And raising your arms and lifting and pushing and pulling, these things can jeopardize the tissues and the muscles from underneath. Don't reach behind your back either. There's no driving and no sleeping on your side. Again, this is about for 3 to 6 months. For your incision care, you want to monitor the sternum daily. You want to notice if there's any increased redness, discoloration, drainage, pain, tenderness, any changes at all in your sternum site. You need to make sure that you let us know right away. Shower daily and keep the area clean with soap and warm water. I don't want any scrubbing action. I want everything to be patted on. So warm water and soap, pat the soap on, let the warm water rinse, and pat dry. No submersion into water, so no tubs, jacuzzis, or swimming pools, and don't use any cream, lotions, or baby powder or talcum powder near that area. You're going to need to monitor yourself at home every day. And routine monitoring is designed to detect and prevent complications as soon as possible. So in your transplant diary, as you see up here in the corner, inside your transplant diary, we have tons of information and resources, but we also have these logs for you to use. And what we see here is every day you're going to need to take a set of vitals. So you want to document the date, the time, your weight, your temperature, your O2 saturation, your blood pressure, your heart rate, and these two values, the FVC and the FEV1. And you'll be able to obtain those two values when you get your microspirometer. Your microspirometer can be purchased online as long as they capture those two values, or you can use the company that we use, which is Remetric Health, and they'll give you a call after you get discharged. You should start recording these daily vital signs while you're in the hospital. And that way you can practice and you can know your baseline before you go home. Your daily exercise log, we really need you up and out the room at least 3 times a day. And we want you to do short interval distances. We don't want you to go long distances because we don't want you to tucker out too soon. We want you to exit your room frequently because that is going to keep things moving. If you go for too long, then you're going to come back and sit down for too long of a time. So up and out the room about three times a day. So walking is very important. And then if you are managing your blood sugar, so if you are needing insulin or you're monitoring your blood sugars, we also have a chart in there for you to document those. Some key points for successful outcomes. You really want to begin this as soon as possible after your transplant while you're in the hospital. And you want to continue this at home or at rehab whenever you are discharged. I have the golden trilogy, 3 things that are going to optimize your lungs the most. And this is only up to you. This is something that only you can do. It's cough, walk, and deep breathe. Your nerves have been injured. So whenever they did this, open the sternum to put your new lungs in, we injured a lot of nerves. And you don't have that cough reflex. So you have to tell yourself to cough. Every 30 minutes or so, try to generate a very deep down cough to try to bring anything up. Again, you don't have that reflex, so you don't feel like you need to cough anything up, but you do. You just had a major surgery and you need to get all the things that are settling out. If you let things settle and accumulate, that's whenever an infection can brew. So you can really get a pneumonia after any kind of surgery. So cough every 30 minutes, walk at least 3 times a day, and you want to practice deep breathing. Your brain has not caught up with the fact that you've just had a lung transplant. So your brain is still working under the thought that we still have a lung disease. So you're shallow breathing. You're holding on to that oxygen reserve. So we need to retrain your brain. No, I can deep breathe. Take a deep breath in, out, every 15 minutes. You don't need to continue to do it over and over again. You might hyperventilate, but you really need to just practice meditating and deep breathing so that your brain can catch up to what has happened. I want to make sure that you're up and in the chair for most of the day. You don't want to be laying in bed all day. That's terrible for your lungs. So make sure that you're up and in the chair. You want to gain your independence. You are your own health manager. And the more you know before you leave, the better success you're going to have whenever you leave the hospital. So start to manage your health while you're in the hospital. So doing your vital signs, learning your medications, getting up out of the bed, doing your exercises, all of these things are going to set you up for a successful outcome. So document in your diary, review medications every day. Transitioning to home. Whenever you go home from either the short-term acute hospital, which we are in at the Brigham, or from a rehab, everyone is going to go home with nursing, physical therapy, occupational therapy initially after transplant. Nursing will stay on for a while. They're going to help you with vital signs. They're going to do a physical exam. They're going to check your incision, and then they're going to reinforce your medication regimen and answer any questions that you may have. PT, they're going to set goals for you. And once you reach those goals, they're going to give you more goals. So they're always going to be progressing with you. They're not going to come in every day, but they're going to be monitoring you maybe 1 to 2 times a week. Occupational therapy will come in the beginning, and they're just going to make sure that they do an assessment, and they're going to make sure that you are able to grab and reach all the things that you need to take care of yourself, and that your fine motor skills are okay and intact. Some items that you're going to need prior to going home. You're going to need a medical ID bracelet. And on that, we want these 2 things engraved: lung transplant and CMV negative blood only. Those are the only 2 things that need to be put on your medical ID bracelet unless you wanted to add something more. You need a digital weight scale and make sure it's calibrated. And you need to purchase a pillow wedge. It has to measure at least 30 degrees. And you can get that at Amazon, Target, Walmart, any of those kind of department stores. When to call your nurse coordinator. You need to call your nurse coordinator anytime you have a question, a concern, a symptom. The sooner you call us, the quicker we can fix what might be happening. If you have an infection brewing and you don't call us right away, then your immune system is going to be reacting and trying to fight off whatever's going on. Now, if you call us and we get the necessary intervention, whether it be antibiotics or whatnot, then once we can get that in place, then your immune system will back off. So it lessens the potential for rejection. So the sooner something starts brewing, you need to let us know as soon as something is arising. So any symptom, you call us. Elevated or low blood pressure, fever of over 100.5. If it's 99 and you don't feel well, give us a call. Declining FEV1 or FEC numbers, a new cough, stuffy nose, scratchy throat, earache, chest pain, shortness of breath, diarrhea or vomiting lasting longer than 24 hours, especially if you're unable to keep any of your medications down. Loss of appetite that's lasted longer than 3 days, weight loss, chills, night sweats, any skin rashes or cuts that don't heal or have developed some drainage, mouth or genital sores, difficulty or pain with urination, dizziness, headache, pain or redness at a wound or a catheter site, your old catheter sites, Anytime a new medication is prescribed to you, and also if you wanted to add a new supplement, and that includes vitamins and things like that, make sure that you let us know before you start anything. Our nurse coordinators are here Monday through Friday, 8 to 4:30. If they do not get back to you, or it is at an off hour or a weekend, you need to page the pulmonary transplant attending. So call the hospital and page the pulmonary transplant attending, and they will get back to you right away. Do not delay, call. I can't stress the importance of that enough. For clinic and follow-up, initially you're going to be seen either weekly or every 2 weeks for the first 6 to 8 weeks. Every clinic visit, you must arrive at least 1 hour prior to your appointment. You're going to need to get your labs drawn, and then you're going to need to get an x-ray before you come into clinic to meet your provider. And whenever you're in clinic, you're going to also have your spirometry done. So make sure that you're getting here an hour before. We really do try to accommodate a time that works best for you, but unfortunately, we're not always able to accommodate that. So please keep that in mind. Thank you for listening to this presentation. We are living in an exciting time of transplant. There are dedicated teams of doctors, nurses, social workers, pharmacists, dietitians, and researchers that give hope to countless numbers of transplant patients. Transplant for some may be viewed as a mixed miracle, and that's understandable. Your life is prolonged, but that doesn't necessarily mean problem-free. Problem-free living is rare with or without a transplant. After the first year, life can get back to some degree of normalcy, and some of these restrictions can be lifted. Live life to its fullest. Just use common sense. Remember, you have an immune system. The immunosuppressive medications don't wipe it out completely. You received your transplant in order to live a better life, not to live in a bubble. The challenge of being a transplant recipient is to learn to recognize the issues as they arise, seek help when needed, and most of all, enjoy the time this transplant has offered you. Thank you.